So early knee wear and tear is a nice way to talk about early arthritis or when the joint begins to show signs of where the cartilage that covers the bone and protects the bone underneath begins to wear out. This cartilage is the bit that is the moving part of the joint, and with time, this begins to thin out, and that's what we describe as early wear and tear. So the main challenge when you start getting early wear and tear is usually pain. Now that pain could be related to activity, such as walking or when you stand up after you've been sat for a long time, either in a chair, in a car. Sometimes you could have challenges doing steps and stairs. Sometimes you have more pain coming down a flight of stairs than going up. Sometimes the problems from early wear and tear could be around stiffness, where you don't feel the knee supple anymore. You struggle to do things like squats, or you struggle to bend down to pick something up off the floor. Those would be the early signs that I would look out for. Early knee wear and tear often starts with us trying to explain to patients the pathology, understanding the condition itself. Treatment could range from taking the occasional painkiller but leaving it alone otherwise, use of my physical therapist to try and understand how to get the joint to be more mobile. There are a variety of injections that are now available for what we call as simple or conservative measures where we don't want to rush to an operation. Now, some of these are available through public health on the NHS, some of them not. Injections would vary from using steroid and local anesthetic sometimes to calm the knee down. We also use products that are known as viscosupplements. Now, viscosupplements, you may have heard of brand names like Ostenil or Synvist. They're based on hyaluronic acid, chondroitin sulfate, with the idea being to lubricate joints and try and rebuild some of that cartilage that's beginning to wear off. There are some newer therapies, newer in the sense they've been around for a few years, but certainly not been around for decades. One of them is putting platelet-rich plasma, which is taking your own blood, centrifuging it, which is spinning it in a special machine, putting the products back into the knee to help cartilage. And then something else I'm excited about in the last few years has been synthetic hydrogel injections. And the current brand name is Arthrosamid. It's worth looking into because this is a polyacrylamide which binds with the synovium, which is the soft tissue in the joint, helps to bring down inflammation, and can studies would suggest it could last up to 5 years of giving good pain-free relief in people with early wear and tear or early arthritis. And I think this is important to understand because every injection will have its own period of efficacy. How long do you expect it to work? And what do you do when it wears off? So studies show that all these injections have different time scales. For example, steroid injections probably have an average efficacy or time span of about 6 months. Some patients, it may last up to a year or two, but in most patients, it fails to relieve enough inflammation beyond the first few months. We have similar challenges with the other products. The other products are more designed to rebuild cartilage, the viscosupplement and the PRP injections. Again, these are not injections we would recommend having every few months, but some patients do benefit from these injections every few years to try and keep the cartilage in good shape. The last of the injections that I mentioned previously, the hydrogel injections, I think are currently the best chance we have of giving relief for at least 4 to 5 years. Now, I always explain to patients that this is average results. Now, each individual result may vary. A lot would depend on how bad your arthritis is, how bad your wear and tear is. And I would be happy to discuss this in person, looking at you clinically, your x-rays, etc. I think the time to see a specialist would be when you can't manage with simple home therapy. So most patients would try and take the occasional painkillers, get on with some simple exercises to keep the knee strong. They reach a point when this isn't helping or the pain and stiffness begins to affect their day-to-day lives. I think that would be the time to find a suitable consultant to chat with.